thank the witnesses for taking the time to come here this morning and the time you've taken to provide some very thoughtful and I think important testimony. This hearing is really about the recent outbreak of avian influenza, bird flu, that has plagued really primarily the upper Midwest, although it's, we have a map here, unfortunately we don't have it in the chart, but it's been sprinkled out west, a little bit further east. Fortunately for Senator Carper's state, it has not gone up and down the eastern seaboard yet. But this is a serious issue. We have a mission statement for this committee to enhance the economic and national security of this country. This is an economic issue. And it's a very serious one. I want to I do ask for unanimous consent to offer my written opening statement for the record, but I do want to just cover some quick stats here because I think we may be interrupted by votes a little bit later on. But in terms of how this is going to affect our economy, there are 300 million egg-laying chickens. Over 40 million of them have been affected by this and have been destroyed. That's 13.3% of the total egg-laying population. There are 238 million turkeys raised every year. 8 million have had to be euthanized because of this outbreak. That's estimated to be about an $8 billion impact onto in our economy. And fortunately, we have not seen a new outbreak since about mid-June, but the migration period is over, but it'll start up again in the fall. And so we're extremely concerned about what's going to happen when we have the migratory bird pattern once again. And the purpose of this hearing really is to examine what our initial reaction was to the outbreak this spring, and also ask and really explore what our reaction is going to be, how are we going to further limit the damage for additional outbreaks so that I hate to say it, probably pretty probable in the fall, including, we don't want it to alarm anybody here, but we have all heard about bird flu potentially mutating from animals to human beings, and that's why we've got a pretty good panel here to discuss that and try and minimize the concern, but also provide assurance that we're going to be monitoring that and do everything we can if something were to happen. But we've got a real good panel, people from the U.S. Department of Agriculture, representative from the Center for Disease Control, from the GAO, a professor from Senator Carper's home state, and Senator Carper will introduce Professor Gelb. And we've got a victim, not a direct victim. You're a human, but somebody from the state of Wisconsin who lost his entire egg-laying flock of 200,000 chickens. And Scott Schneider is here to just describe what he's gone through and his appreciation for what the USDA has done, but also just the frustrations in terms of getting compensated in a timely manner as well. And that's part of the hearing. But again, this is, I think, a very important hearing. And totally appropriate for this committee. So with that, I'll turn it over to our ranking member, Senator Tom Carper, who, like I say, is so far Delaware has dodged the bullet, and let's hope that remains the case throughout the year.
Thanks.
Schneider, I think I'll start with you. I think your testimony, first of all, thank you for your testimony, and we obviously are sorry for your loss. But what I find interesting about your testimony is I think you share my perspective. I've been very impressed with the quality of the federal workforce. I mean, just really dedicated individuals doing a great job, which is exactly what you experience as well, and that's a good thing. But frustrated by the problems that you encounter based on the bureaucracy, with the rules, what they're trying to follow. So I just kind of want to follow up on that. First of all, you are a contract producer, correct? Somebody else owns the chickens, and you run the operation.
Yes, that's correct.
Now, when we met yesterday, I appreciate you coming in early, you described to me the indemnification process for the actual chicken owners. It took, what, 4 to 6 weeks for them to be indemnified against the loss of the chickens, correct?
That's my understanding, yes.
But you are, as you say, there's no business interruption insurance. You can't buy this kind of insurance in the open market. This is only provided, and it's a good thing that we have this indemnification through the USDA. But as Professor Gelb was talking about, there's a problem in terms of indemnifying for operational losses, as well as the, trying to recover and doing what you're trying to do to remake your farm. Is that correct? Can you describe how much you've spent and what your frustration is in terms of being indemnified as the operator?
I think one of the situations that I'm running into is that I will be fronting probably close to $150,000 in terms of depopulation, cleanup, and disinfecting before I'm able to start repopulating my complex. It's difficult for me to come up with that kind of cash, and it's difficult to try to make sure that I am dotting all the I's and crossing all the T's when it comes to the formats that the USDA is going to require me to do when it comes to expenses and identifying which expenses are recoverable for me. And every day goes by, I become a little bit more concerned that some of those expenses might be left out or forgotten or somehow not covered. And I stand to lose a lot more money on top of what I'm already losing.
And again, if you're not able to repopulate your operation for 8 months, I mean, are you going to be able to start generating revenue anytime soon, or is it really you're not going to generate anything for 8 months?
When I start repopulating, it'll be an incremental process. I have the capacity of 200,000 birds on my farm, and I'll start incrementally adding flocks to the tune of about 45,000 birds every month, starting in August and October.
Now, will you buy those as egg-laying chickens right off the bat?
They're ready to lay. Yeah, that's correct.
So you'll start generating revenue.
That's correct.
Okay, Dr. Clifford, you know, in the private insurance market, you know, you get an insurance adjuster coming out on site, assessing it, verifying the claim, writing a check sometimes that day, or within days, or certainly a week or two. To me, this is a pretty simple claim to adjudicate, particularly the chickens. I mean, here's the program. It is federal law that the chickens have to be destroyed, and it's federal law that they, you know, there's indemnification for those owners of those chickens. Now, I would think, okay, we verify that this is a AI, and the chickens are destroyed, and I don't know why the government can't write a check literally within a day or two to indemnify first the owners of the chickens. Can you tell me why it would take 4 to 6 weeks for the owners of the chickens to be indemnified?
So with regards to indemnification, we can actually do that within a week or less.
But again, that wasn't the case in this,
I understand.
correct? Okay.
What I was going to say, though, is what we require is a flock plan to be signed. And until that flock plan is signed, we don't pay indemnity. What the flock plan is a strategy and plan for that location, specific to that location, with regards to biosecurity and restocking to ensure that we're all doing as much as we can to prevent reinfection. If there's not a signed flock plan before we pay indemnity and they get reinfected after they repopulate, we don't pay indemnity a second time. So I think there's things that we can do together to make that a lot quicker process. My heart goes out to Scott and his issues, and we've heard this from many producers. Some of these things are complex because they've never dealt with them. So one of the things we're doing to combat this in the future is assigning one person to that facility from the beginning to the end to work with the producer and to help them get through these things.
Okay, so you're learning from that. Mr. Schneider, real quick, how long did it take USDA to get out to your operation to inspect and really order the destruction of the flock?
I think the USDA needs to wait until the presumptive positive is actually confirmed by the National Laboratory in Iowa before they are able to do anything. And so in my case, we had a presumptive positive, I think it was on maybe a Thursday of the week, and on Saturday evening, it was confirmed by the National Laboratory in Ames, Iowa, and I think it was on that Monday then that we had USDA people.
And then how quickly was your flock destroyed? So Thursday you detected,
yeah.
I mean, you saw chickens dying, right?
Right,
Basically,
they were.
They died quickly. And then, so that was Thursday, and you started destroying your flock when?
It was probably the following Thursday or Friday, possibly.
So Professor Gelb, in your testimony, you said that process should be 24 hours. That's a pretty big gap. There's a fair amount of continuous improvement required here, correct?
Yeah, yes, ideally. In Delaware, back in 2004, our goal was 24 to 48 hours in that window. And in fact, again, that hinges on the identification of the virus. If we go back to Scott's point, that's a very, very important one. The process, the presumptive positive is made by a local or regional laboratory, a national animal health laboratory Laboratory Network member laboratory. That's a mouthful, but it's a USDA, very important, very highly regarded USDA laboratory network system that we here have nationally. They are based in Ames, Iowa. The confirmation must come, this is a very important point, from the national laboratory in Ames before it's actually a done deal, so to speak.
So let me just say, so in the current structure, we have these sites. Best case, if you restructured the process, I mean, because sometimes tests take a while.
Sure.
You know, sometimes they have to incubate. Or what is best case? If you could design a structure, what was the best case in terms of Mr. Schneider calling somebody, you collect a sample, how quickly could you have that confirmed? Again, best case, not in, you know, I guess with current structure, but if you really redesign this thing.
Yeah, once the samples are submitted to the local regional NOM laboratory, those results basically are molecular types of tests that can be completed in about 3 hours. Then those same samples, it's mandated, must be sent to the central lab in Ames for testing and for confirmational testing. So at the local lab, they're presumptive, and we're really waiting for that confirmational testing. So frequently, they're going to be sent by overnight delivery. Okay, so it might be another 24 hours. So you're basically waiting then that additional 24 hours before you can take action in terms of initiating flock depopulation.
I want to stay on this and want my committee members to indulge me a little bit. In your experience, or maybe I'll go to Dr. Clifford, in your experience, how often do you have the initial result differ from the confirmation result? And are there instances of that? I mean, so the question I'm asking is, if, you know, could we rely on the initial result, and it would be destroying a flock of chickens, and all of a sudden, ooh, that really wasn't avian flu?
These regional NOM laboratories are basically laboratories of the NOM. They are many times, if not all, many times accredited laboratories with very high quality staff. And I'm not getting to yours, I'm giving you a little more background. All of the members that run these molecular tests take proficiency panels, once a year unknown proficiency panels that come from USDA. We're talking about highly qualified laboratories. I think.
So again, so the point is, we could improve this model. So we could, you know, we could have destroyed that flock of chickens within a day or two, within your guidelines, 24 to 48 hours rather than 7 days, which again just increases the likelihood that these outbreaks won't be contained. I mean, from my standpoint, for the USDA, if we've got to write a law or improve regulation, there's a real top priority of what we ought to do as a federal government to speed that process to limit the damage. I mean, would you agree with that, or?
Yes, I would.
Okay. I've got plenty of other questions, but I'll turn it over to Senator Carper. Ms. Clifford, real quick, because I want to get into the insurance or the emergency funding. Is there a program in place to indemnify Mr. Schneider as an operator?
There is a program in place that pays right now for the owner of the birds. So if Mr. Schneider is a contract grower, what we have been doing is working with the companies to make sure that payments do go to the contract growers or contract raisers. I'm not sure.
Yeah, that's something you're trying to do, working with a law that does not contemplate indemnifying the operator.
Well, actually, sir, what we did in the low-path AI situation quite a few years ago in Virginia, it's part of our regulations on low-path. It requires the contract growers to be paid. The problem is with this particular high-path, that particular regulation is written into the AI rules for low-path, not for high-path. And so we paid the owner of the birds.
Correct. Well, so Mr. Schneider, you got a problem there, and we need to work with our ranking member to figure out what we need to do to address that, because that's obviously devastating for the operator when it's just the owner being paid. And, you know, maybe that's an agreement between the owner versus the operator, but that's something that needs to be addressed. Dr. Clifford, you talked about personnel rotation. How many USDA offices do we have around the country?
Veterinary Services offices or USDA offices?
I mean, where you can have you can have qualified personnel to respond to this.
Well,
yes, I'm surprised we're rotating personnel versus just having
We don't have that many trained people to do this. You're talking about animal health technicians and veterinary medical officers. I've got about 1,800 people that serve in veterinary services. I'm not talking about just any USDA person.
But again, if you're talking about a point person to manage a case, I mean, you really need somebody who's skilled in management, not necessarily in the hard
No,
science.
sir, they need to understand the science as well. In this case, when they're working with them and helping them develop a flock plan and a compliance agreement, they not only need to understand the red tape, as you call it, but also the science.
Okay. Well, again, I think that could be an interesting discussion to have in terms of, again, if the whole purpose of this is to coordinate an effort with one point person that a owner or operator is dealing with. Yeah, I think you could certainly have an interesting discussion whether or not that person has to be trained in all the, as opposed to just trained in managing and coordinating the different expertises. But let me move on. Dr. Schuchat, I want to talk a little bit about the virus itself and potential and vaccinations. First of all, how robust is the flu virus? I mean, how long can it survive if it gets on a dust particle and gets blown into other farms? I mean, is this virus going to last days, weeks, months? Is this pretty fragile?
The virus won't last that long, but the conditions are quite important. So the colder weather and the drier weather permits is favorable to the virus. So right now we're sort of in a quiet period for.
Talking to Mr. Schneider said the virus can actually be in a snowflake as well, and so it'll last a little. So, but are we talking days then that the virus will last?
Yeah, I think the issue with the disinfection is to make sure that it's not, that you've reached everything and that it's not coming back.
In terms of the vaccines, so we're concerned about trade, the implications of that. I think it was Professor Gelb was talking about the potential mutation of the virus with vaccines. Can you speak to that a little bit?
That's right. Influenza changes constantly, and that's why it's so difficult. It can mutate, and it can also reassort, so swap parts of its genes with other influenza viruses. And 2 of the 3 H5 strains that we're dealing with, the avian strains in the U.S., are these reassortants, where we had high pathogenic H5 avian influenza from Eurasia that swapped out parts of its genes with the low pathogenic avian influenzas that we had here in the U.S. already. And so the virus is just constantly changing, which makes vaccine development difficult. The vaccines that we have for humans as well as for animals are not as highly effective as some of the other vaccines, and the virus can kind of mutate away from or escape from the vaccines. There's a lot of balance about the avian vaccines and the human vaccines. Of course, we do work to prepare candidate vaccine viruses and, have stockpiled vaccine against the original H5 strains from Asia, but those are really preparing for pandemic readiness rather than vaccines that we're using every day.
We're always expecting just a technological miracle to save us from all these things. But again, what you're talking about with a vaccine, it is only going to be a certain percentage effective to begin with. Plus, we've got a real problem with vaccine production in this country, do we not? I mean, we have a hard time producing enough vaccine sometimes for human flu. Would we have, I mean, if we start trying to vaccinate, 300,000 chickens or 300 million chickens, a couple hundred million turkeys, do we even have even close to capacity for that? And can we ramp it up quickly enough to respond to the changing virus?
Let me answer about the human vaccines and let Dr. Clifford respond about avian vaccines. The U.S. has invested an enormous amount in expanding our manufacturing base and the investment in influenza vaccine production and distribution. We actually have had an 80% increase in the flu vaccines produced and distributed annually in the past decade, as well as a much stronger infrastructure for pandemic vaccine production for humans. But the animal vaccine production works differently.
Let me quick stay on the human vaccine, because I think this is important. We had a pretty robust vaccine production capability, correct? But then it was reduced dramatically. A lot of those lawsuits, that type of thing, people, it just was not an attractive business to be in. So drug manufacturers exited the vaccine business, correct? So we had to have almost government intervention to try and boost that production. in case of a pandemic or in reaction to some of these outbreaks, correct?
That's right. There's been a lot of U.S. government investment in stimulating the vaccine industry, both for influenza vaccines and then actually for routine vaccines. We have a very strong public-private partnership right now where vaccine companies actually are making pretty good profits right
But again, I want to go back to sort of the root cause of why we didn't have the amount of capacity we really needed vaccine. It really was because it was a very unattractive business. People were being sued and people just exited the business, correct?
Well, I think it was less the suits than the issue of the profitability, because when you're producing drugs, people will take medicines for their whole life, and successful vaccines, you need a couple doses of perhaps forever to prevent diseases from occurring. Flu vaccines you have to give every year right now, but the market wasn't that favorable. But things have changed a bit, and we're in much better shape for pandemic readiness right now.
So is the manufacturing capacity different for animals versus humans? Dr. Clifford, answer that.
Yes, it is. And our Centers for Veterinary Biologics works with the companies here. So I'm not concerned about capacity. It's more economics with the companies, knowing that we would use the vaccine.
It's still the same production technique, though, correct? By and large?
By and large, but there's new techniques that being used as well that
Can speed the production, the development?
Yes.
So there's more capacity available for animal vaccines because you just don't really risk the liability problem? I mean, why do we have so much more capacity for animal vaccines versus human?
I really can't say that from a standpoint of the human side, but we have a lot of companies that are both domestic and international that have, if they don't have the capacity here, that they can have approved products that they can move here. So if it can't be produced here, it can be produced somewhere else. And so the capacity is there to produce the vaccine.
Just a quick question for you and Mr. Currie. You're going to have a GAO audit on this. Dr. Clifford, how do you think the USDA is going to fare in that audit? And I'll ask Mr. Currie the same thing. I realize it's a little unfair, but I just want to, I've had my facility audited. I have a general sense of this is going to be a good one or I might have some problems.
I think they'll find some good things, and I think they'll find some areas that we need to improve on, and I think you'll oftentimes find that kind of situation. And some of those lessons learned, we are definitely taking those and working with the industry and states to move those lessons learned so we don't repeat those same mistakes in the fall and spring.
Mr. Currie, do you think you're going to see some improvement from the last time you looked at this thing? They've already learned from lessons, implemented some things, and what's your general sense?
Yes, sir. I think, well, we know, for instance, we issued a report on the potential response to an outbreak like this in 2007 and made a number of recommendations that touched on almost to a T all of these challenges that we're facing. I don't know if any of us expected it to be this big and this bad. USDA addressed all of those recommendations, and so they're being tested now. In any emergency, whether it's a natural disaster or an outbreak like this, there's going to be challenges and lessons learned and things we didn't expect and after action reporting that we're going to have to study too. So
again, there's been a good reaction to your prior reports, so hopefully, but again, there'll always be lessons learned. It's never perfect, always room for improvement. First of all, let me say you took the words right out of my mouth. My own background, my parents both were raised on small dairy farms. That tradition of the family farm is dwindling, and we can't allow that to happen, but we also can't allow people like Mr. Schneider to remain exposed. I think in this hearing, I have learned that he is exposed. I thought we had coverage. I thought he was just having a hard time obtaining that coverage. I'm afraid he's completely exposed, so I think both Senator Carpenter and I will certainly work together to see what we can do to help those in Mr. Schneider's position, and not just Mr. Schneider, but everybody affected this now and in the future. So that's, I think, a real commitment of this committee. It's not necessarily in our jurisdiction, but this is certainly, our ability to hold an oversight hearing, to expose that particular problem. As I said before, the panel sat down, this is about getting people to admit we have a problem. I think this is a real problem that needs to be addressed urgently. Mr. Schneider. As we discussed in my office too, there's got to be something like, in my business, I purchased business interruption insurance. If you have a catastrophic loss, and let's face it, you destroy your flock, that's a catastrophic loss. So we've got to do something there's got to be some indemnification, some insurance that will keep you in business, business interruption insurance. And honestly, I'm shocked that we don't have that either as a government program or as in private insurance for that capability. So again, that's to me a real takeaway of this hearing. So again, I just want to thank all the witnesses for your testimony. I'll state again, this committee really does have a great deal of sympathy for your loss, Mr. Schneider, and we're dedicated to doing what we can to help you out of your predicament. But this hearing record will remain open for 15 days until July 23rd at 5 p.m. for the submission of statements and questions for the record. This hearing is adjourned.